Thank you. I now recognize Dr. Bera from California.
Thank you, Mr. Chairman. The title of this is Lessons Learned and the Path Forward, and there were a lot of lessons learned, and there's a lot that we should be thinking about. This is an area that I've spent my 6 terms in Congress thinking about pre-pandemic. My staff would early on often wonder, like, why are you spending so much time thinking about this? I'd say, go watch Contagion, and unfortunately, we lived it. That wasn't the hope. Post-Ebola, we put in some things in place, in terms of having someone who was in charge of pandemic preparedness at the NSC looking around. Programs like the PREDICT program that would be out there, and I visited those folks in Sierra Leone to see what we were doing to try to have early warning systems and do disease surveillance. A lot of that was dismantled in the first Trump administration. We sounded the alarms that it would make us vulnerable. I'm glad that we put some of that back. Early in the winter of 2020, we sounded the alarms when we saw what was going on. We had the first hearing in Congress about this novel coronavirus and understood it was something different. We've now spent the better part of 4 years talking about COVID origins. I don't think we ever get to the bottom of that because evidence is probably destroyed, and it was unfortunate we weren't able to get to the hot zone immediately in early 2020. I would urge us as Congress and the country to just accept both as plausible theories so we can, if it is a lab leak, let's actually raise lab standards. Let's have the ability, if folks are doing gain-of-function research and other research that is absolutely necessary for preparedness, let's make sure they're adhering to the highest lab standards. We also know that viruses occur naturally and they're naturally occurring pathogens. We should do everything we can to try to prepare for that, and I think it's time for us to move on. We have to better understand with a novel virus and a pandemic in a very fluid situation where new information is coming in, how do we get that information? How do we communicate it to the public? Because what we knew in March of 2020 was very different than what we knew in October of 2020. And again, in a fluid situation where people are scared, we should spend time thinking about how we allow the scientists to be the scientists, how we allow the politicians to be the politicians, but not have the politicians try to be the scientists and the scientists try to be the politicians. How do we work together to communicate that, again, to a scared public? Dr. Marchson, you talked about the critical vulnerabilities in our supply chain. Those clearly were exposed. We as Congress should do everything we can with the rest of the world to address those critical shortages, think about what that looks like, and fairly quickly where it makes sense on APIs, on protective equipment, et cetera. Make sure we've got adequate stockpiles, but we've also got the reserve capacity to flex up fairly quickly. Early on was involved in lots of conversations that talked about various strategies of, we knew older patients were more vulnerable. Perhaps this did not seem to be impacting younger folks as quickly as possible, given the devastation we're seeing in New York. We made broad decisions, which I think made sense at that juncture. But as we gained more information, we should have fed that back into strategies. Totally understand why in the spring of 2020 we closed schools. Was that the right decision in the fall of 2020? We've got a perfect ability to different states to different things. We should go back and learn from that and feed that into the future. So if we're faced with the same dilemma, we have that information. I still have plenty of questions about why, as this virus evolved, it came up through the East Coast, through Italy, into New York, devastated New York. We had the first naturally occurring case at my home institution, UC Davis, but it didn't rip through California. It didn't, I would have expected to see really bad results in Japan, densely populated area. They were a little bit more open, older population. Why did the virus impact different countries differently? Didn't rip through India, which we were incredibly worried about. I would hope that we, in an objective way as a scientific community, taking politics out of this, could go back and try to understand the epidemiology. Was it that Japanese culture is a mask-wearing culture, et cetera? So, there are plenty of questions that still remain outstanding. If we could allow the scientists and the academics to address those things, I would hope that we as Congress could fund those studies, understand it, not to prosecute anyone or anything else, but to actually better prepare ourselves as a country and a world. You know, our public health systems, I knew, had atrophied. We had very bad disease surveillance systems. Obviously, we've stood up wastewater surveillance and other measures. We could do better, though, to protect our public. And it is not just naturally occurring pathogens. The chairman and I sit on the Intelligence Committee, and we talk about, you know, the vulnerabilities of bad actors, of biothreats, et cetera. We ought to, as a Congress in a nonpartisan way, learn from the past, but better prepare ourselves for the future. There were real successes as well. You know, I never would have expected that we would get a vaccine, several vaccines that were safe and efficacious within 12 months. We did it. Some of that was because of prior investments in research at the NIH and elsewhere. Can we get that from 12 months to 3 months? Can we, the FDA successfully streamline processes to get biotherapeutics to market? What are lessons learned there? Can we take some of those and actually use them to develop those therapeutics and countermeasures fairly quickly? I'm out of time. I can go on, but I would hope as we look forward, we actually do a real objective analysis without trying to point blame. We got things right, we got things wrong. Let's actually learn from that, and let's better prepare for the future. Thank you, Mr. Chairman.